Dr. Tahira Redwood. I'm a structural and coronary interventional cardiologist. We're able to do procedures without doing open heart surgery. So we're able to fix heart attacks, we're able to put in new heart valves, we're able to close holes in the heart with the patients usually just gently asleep, and they go home maybe the next day or in 2 days. Very safe, doesn't need to be admitted to the intensive care unit, very short stays, and they're very well after. It's a very safe procedure, and it all happens in this room.
Prior to being able to do this, how was it done?
Okay, so before, heart valve procedures were done with open heart surgery, where they would have to do an incision in the middle of the chest. They'd have to open the rib cage and replace the heart valve manually. But now in our minimally invasive way, we don't have to do any surgical incision, we don't have to open the chest. We go through a blood vessel in the leg, and there's like almost no scar. We pass the heart valve up to the heart. We place the heart valve in where the old heart valve is. We open it up and you get a brand new heart valve, no scar. You're up and about the same day.
And this is for adults and or children?
So most of the procedures are done in adults. However, some of the procedures can be indicated in children, especially when I have to close holes in the heart. That's typically done in children. And we have had to put in a new heart valve for a 17-year-old that was too high risk for surgery, open heart surgery.
Okay. Usually when you have this kind of procedure, what is your team comprised?
So my team, they're all over. Today's a really busy day, but my team consists of nurses, radiographers. Sometimes our radiologists are also on standby, or cardiac surgeons are on standby for any emergencies. Dr. Gordon, who just stepped in, is also one of the second operators. So that's our team. It's a very specialized, intensely trained team, and without each and every one of them, we cannot do this procedure.
Do you have an idea of about how many such procedures you have done since this has been in place?
So for heart attacks, they've done very many procedures. They do hundreds a year, so thousands of heart attacks since the lab has been here. And you know, the lab was originally up at the top by radiology for a number of years. In terms of heart valve procedures, we've done about 10 heart valve procedures in different valves. Actually probably closer to 15, because we're also doing the rheumatic heart disease patients again, which is a very specialized population, very common in Jamaica, that usually affects young females, that their heart valves get damaged with the history of rheumatic fever. So we've done about 15 cases.
Dr. Bruce mentioned to me that the specific procedure is recommended for patients over the age of 65, as it is safer. Is this a special focus on people who are 65, that they present with certain types of
heart disease? Definitely. So as you get older, your heart valves can get calcified, and this can make them very narrow. And for some people, it can even leak, so the blood can flow backwards instead of forward, causing lots of symptoms: chest pain, blacking out, heart failure. So these patients, especially those over 65, it is indicated that we do the minimally invasive heart valve replacement in patients with what we call aortic stenosis, which is narrowing of the heart valve, and in those patients it's indicated all patients over the age of 65.
Okay, since you've started this procedure here, have you treated more males than females? You're looking at the gender?
It's about 50%. I think one hesitance is the referrals and the costs, because the cost of the devices are very costly, and the UHWI does their best to minimize as much cost as possible. The equipment is still pretty expensive. Our population is aging. We have more and more patients presenting with heart disease, and as you know, heart disease is the leading cause of death in Jamaica and the Caribbean. So it's a very needed procedure. So you know, with health insurance and the cost of it, it is difficult for patients, but once we're able to cover the cost, we do it for all the patients over 65 years.
How much does it cost?
So the heart valve itself costs about $14,000 US for the heart valve itself.
And that is something that they would have to purchase before?
Generally, you have to purchase it before, so we do multiple investigations. We choose the size of the valve that's going to fit you, because every person has a different size heart valve, and whether the insurance or the patient themselves have to upfront the cost. Unfortunately, if we could get those free, that would be also great. So, yes.
Okay. How much does other issues like obesity and hypertension and diabetes contribute to these kinds of surgeries for you to treat?
So diabetes, hypertension, and other risk factors, my surgery is perfect because they don't typically contribute significantly, which is why my surgery is perfect, because it's very, very low risk. So it doesn't matter what illness you have. Generally, my surgery is pretty safe, and the risk of anything bad happening is very, very low. Versus if we're to do open heart surgery, we'd have to take all of these things in consideration because those increase the risk of your complications during open heart surgery. But for our surgery, it's very safe. They typically don't play a factor in how safe the surgery is.
Okay. I mean, I know that, persons, based on their, precondition, some surgeries would be shorter or some longer. What's an average time for a surgery?
The average time for a heart valve to be changed is about 2 hours. That is with the sedation from our anesthetist, to putting in the valve, to waking up and being able to eat.
Huh?
2 hours. Yeah, that's why it's an amazing surgery. It is the surgery that anywhere else you go, this is what you'd be getting. So if you're in the US, if you're in the UK, this is the procedure you'd be getting over open heart surgery. Unless we could not put in a valve, then this is the procedure you'd be getting. It's short, it's quick, it's very technical, it's very complex, but we've done it many, many times. I've done it many, many times, so it takes me 2 hours to do it.
Compared to what you can do now with this procedure, just describe the differences.
So I'm not a cardiac surgeon, but I will go through the basics of that. So open heart surgery requires much deeper sedation. The patient has to be intubated and put to sleep, which is different from my procedure. You're not intubated, we're just sedated heavily. So you're just in a very deep sleep versus having to be intubated. You'd have, as I said, have to do an incision and cut the breastbone, the rib cage open so that they could access the heart before. We don't have to do anything. You don't have any scars or anything. We don't have to put the rib cage back together. We just go through the leg vein or artery, as we said, and we can put the valve through that. So by the time you come out, you won't even know you had a procedure. You just feel so much better and you have a new heart valve. Typically after open heart surgery, you require admission to the intensive care unit, and we always know that there's limitations with hospital beds, especially high care hospital beds. You don't require that in my procedure. You can go back onto the regular ward where you're attached to a cardiac monitor and observe, because that's how safe the procedure is. Typically the recovery for open heart surgery is a few weeks. You're up and about the same day. We usually say don't lift anything heavy for about a week, but you're back to whatever you were doing before in about a week or two. And no physiotherapy is required except for the usual cardiac rehabilitation that you should be doing anyway for if you have heart disease.
Okay. What is the difference between your medical specialization versus that of a cardiologist?
A general cardiologist? So I had to do general cardiology prior to doing this. So I went away, I did 2 years of general cardiology, then I had to do what we call coronary interventional, so that's for heart attack. So anybody with a heart attack, there's a blockage in the blood vessel, we put in a special stent, a device to open up that blockage to make sure that the blood can flow down to the heart muscle. So I had to do that. Then I was able to specialize in what we call structural heart disease, where I have the ability to fix the heart valves, and I also did adult congenital, and that's how I can fix holes in the heart and abnormal connections.
Are there many persons in the medical field with your kind of specialty?
So generally, no. Well, not with all the ones I have together. In the Caribbean, there's no one that's available with all of mine specialties. Definitely if you go to the US, Canada, UK, Western Europe, you definitely find more people, but our conferences are generally smaller than a general cardiology conference.
Are you called sometimes to go to other territories to perform surgeries?
So I have been to Guyana. They have an amazing team in Guyana, an amazing complex heart disease coronary, Dr. Terrence Haynes, and they did ask me to do some heart valve, we call them TAVIs, in Guyana, which we did. Their first 2 successful procedures. Those patients are doing great. So I have, and there are other territories that have sent their patients. So patients have come from Bahamas, Antigua, and Turks and Caicos, because we try to make it so affordable for Jamaican people. It's also clearly more affordable for the rest of the Caribbean. And of course, we have a very high success rate, 100% success rate in our procedures.
Okay. Can anyone predict that someone will have issues with their heart?
No, it's very, very difficult to predict. However, if you have any symptoms, any concern, you're feeling lightheaded, you're having chest pain, you're having shortness of breath, you're having leg swelling, difficulty breathing, you can't lie down flat, you should visit a cardiologist and get your heart checked out. Your heart racing, get it checked out, because all of these symptoms can be a warning of something happening.
Jamaicans have a tendency to watch things. We are going watch it. You feel this way, you're going to watch it, or you're feeling this way on a Friday. May I wait until Monday morning? What's your advice for them?
So watching does not work. The longer you take to fix a bad heart disease, the more expensive it is, the harder it is, and the more damage to your heart in the long term, and the more medication you're going to need in the long term. If you have chest pain, do not watch it to see how it feels and then show up at 2 a.m. because you can't sleep. As soon as you feel the chest pain, you need to come and check it out. Whether it's your nearest doctor or your nearest hospital, you need to check out any heart symptoms that you may have. You need to check them out immediately. It will cost your heart the longer that you wait.